Ladies and gentlemen, it is my honor and pleasure to welcome you back to my YouTube channel. My name is Bernard Odao, and before I continue, may I take this opportunity to thank all those who have subscribed to my YouTube channel. If you have not, kindly do so, and remember to hit a notification bell so that you can be notified whenever I uploaded a new video. So today in this video we are going to discuss about a medical condition called hemorrhoid, what causes it, how it presents in our body, how we can prevent it, and some of the complications which may arise from this condition. So please stay tuned and watch this video until to the end so that you can be able to educate each other and also learn more on how to improve our health. So to start with definition, hemorrhoid, these are swollen veins around our anal region and to the lower part of the rectum. These hemorrhoids can develop inside the rectum, which is being referred as internal hemorrhoid, while those which develop outside or under the skin around the anal region are being referred as external hemorrhoid. This hemorrhoid can be further classified into 4 degrees or 4 grades depending on the way they present in our body. And in this video we are going to discuss about each one of them and see how it presents in our body. So in the first degree, hemorrhoid normally present with anal bleeding with no protrusion or prolapse through the anal opening. In the second degree, hemorrhoid normally presents with protrusion or prolapse through the anal opening, but it normally gets back spontaneously. In the third degree, hemorrhoids normally present or protrudes. Hemorrhoids normally present with protrusion or prolapse through the anal opening, but it can get back manually or by pushing it with our fingers. The fourth degree is the most severe degree, and here hemorrhoids protrude through the anal opening, but it fails to go back into the anus, and this is the most severe grade or degree of hemorrhoid because it normally requires an emergency medical attention. So from there we are going to discuss on some of the causes of hemorrhoid, and the first one is prolonged sitting in the toilet or whenever we are passing out our stool. The second one is straining so much whenever we are passing our stool, because this can increase pressure to the pelvic region, which may cause the swelling of the blood veins around the anus, later developing into hemorrhoid. The third cause of hemorrhoid is chronic diarrhea or constipation. Constipation, this is a condition which causes difficulty in passing out the stool, and it is normally associated with hard stool. The fourth cause of hemorrhoid is obesity or excessive weight, because this can also lead to pressure around the anal region, which causes the vein to swell, later forming hemorrhoid. The fifth cause of hemorrhoid is pregnancy. Pregnancy as a result of enlargement of uterus. This can exert pressure to the anal region, which will also cause swelling of veins. The sixth cause of hemorrhoid is eating low fiber food, because high fiber diet normally increases the bulkiness of stool and making it soft for easy passing out. So whenever you eat a low diet fiber, this can easily cause hemorrhoid. The last cause of hemorrhoid is regular heavy lifting. By lifting heavy object regularly, this can lead to straining, and this straining can also lead to hemorrhoid development. So from there we are going to discuss on how we can prevent this condition, and there are several ways we can prevent them. One is to go to the toilet whenever we feel the urge of going to the toilet. This will prevent piling up of fecal matters around the rectum, which can easily make it difficult to pass out, hence causing hemorrhoid. The second way we can prevent is by eating a high fiber diet, because as we have already explained, high fiber diet will increase the bulkiness of the stool, hence making it easy to pass out. Another way of preventing hemorrhoid is by drinking a lot of water. Yes, by drinking a lot of water, this will loosen up the stool, hence making it easy to pass out. Another way of preventing hemorrhoid is avoiding sitting for a long period of time. The way of preventing hemorrhoid is through regular exercising. By regular exercising, this one will lead to reduction of excessive weight, and this will lead to reduction or reduced chances of the hemorrhoid development. Those are the few practices or the ways we can practice to avoid hemorrhoid. So from there we are going to see signs and symptoms of hemorrhoid. And the first sign of hemorrhoid is per-anal swelling. This is normally detected or noticed whenever we are passing out the stool. You will feel like there is a swelling around the anal region. Another sign of hemorrhoid is per-anal bleeding. This normally results as a tear or damage of the blood vessels around the anal region, which will present with a red blood bleeding on your tissue paper. Another sign and symptoms of hemorrhoid is irritation around or burning sensation around the anal region as a result of recurrent protrusion or prolapse of hemorrhoid. Another sign of hemorrhoid is a hard lump which is normally formed around the anal opening. This mostly occurs in cases of external hemorrhoid. Yes, those are the few signs of hemorrhoid. So from there we are going to discuss about some of the complications of hemorrhoid. And the first complication is bacterial infection. During hemorrhoid, there is rupture or tears of tissues around the anal region. This can easily form an entry point of bacterial infection, which will later infect the tissue around the anal region. Another complication of hemorrhoid is anemia. Anemia, this is the reduction of red blood cells in the blood. This occurs as a result of excessive bleeding, which will lead to loss of blood and later causing anemia. The last complication, which is always emergency, is strangulation. Strangulation, this normally occurs whenever the hemorrhoid protrudes through the anal opening and it fails to go back. This can cut off the blood supply toward this hemorrhoid, hence leading to strangulation. So that brings us to the end of this topic today, and I hope you have enjoyed, and kindly ask you to continue watching my videos so that you can educate each other and also learn more on how to improve our health. Thank you very much, and remember to subscribe. May God bless you.